In today's lectures, I am going to deliver mainly two things. One is a basic concept about obstructive and restrictive lung disease, and I'll also discuss about different type of lung function tests and what is the clinical significance of those tests for the diagnosis of obstructive and restrictive lung disease. So at the very beginning, before knowing the different type of lung function test, we need to know what is the physiological features of both the obstructive and restrictive lung disease. So, as term denotes obstructive and restrictive. So here, in both the case, some physiological complications occurs in the airway passage, and the functional features of alveoli also altered. So here, first we will learn what is the basic features of obstructive lung disease, right? So here, both the obstructive and restrictive lung disease are two broad categories of respiratory conditions that affect the lungs and the ability to breathe. It means here both the obstructive and restrictive lung disease affects our breathing capacity, right? So here they are not only physiologically different. If you see the causes and the treatment approach for both the obstructive and restrictive lung disease are also different, right? So what is the most important features of obstructive lung disease? Here, the obstructive lung diseases, actually obstructive lung diseases are not a single disease. It means it composed of a group of disorders, right? In this group of disorders, there is an obstructions or narrowings of the airways. So this is the most important features. Means there is an obstruction or narrowing of the airways. So due to these obstructions, it makes difficult for air to flow in and out of the lungs properly. It means here obstructive lung disease affects both the inhalation process and exhalation process. If I say more correctly, obstructive lung disease is the disease which mainly affects during the exhalation process, right? So why the disease is more pronounced during exhalation, not in inhalation. So to know about that, we must know about the normal functional characteristics of our lungs. If you see the functional characteristics of normal healthy persons, in healthy persons, as we know, the lungs basically composed of lots of elastic tissue, right? And those elastic tissue actually helps to maintain recoiling features of the lung. This is the normal property of lung, right? So in healthy persons, what we see, due to the presence of those elastic fiber, right, the lungs easily can recoil. At the same time, due to the negative intrapleural pressures, the lungs always start to make an inflated conditions, always start to expand, right? It means during inhalation process, lungs becomes in expanded conditions. which allows the lungs to accommodate more amount of air into the lung alveoli, right? And during expirations in healthy persons, lung a little bit smaller in comparison to the lungs during inspirations. But here in our discussion is mainly the conditions called obstructive conditions. So as I mentioned, the obstructive conditions actually characterized by the limitations of airflow during exhalations. So why? It is mainly due to, suppose this is a lung airway, right? So here in this lung airway, some obstructions are there, right? So what happens during inhalations in obstructive state? The outward pullings of the air passage is there, right? Outward pullings of the air passage is there, right? That makes the air passage little bit dilated during inhalations. That helps to inhale the at least the sufficient amount of air that is required for the breathing, right? But if you see in the exhalation process, when the person is suffering with the obstructive lung disease, there is a very less amounts of outward pull. Instead, it tries to collapse, right? So, due to the reduced amount of outward pullings of the air passage, it becomes narrower and narrower, right? And due to this narrowing of the air passage, it prevents the outflow of air from lung or from lung alveoli. So that is why I mentioned it is obstructive lung disease actually involved with the limitations of airflow during exhalation, not during inhalations. Another important thing that I should mention, due to the obstructions of the air passage, it ultimately increased the airway resistance, right? So these airway resistance during exhalations actually prevents the outflow of air from lungs. Now, if you see the different type of obstructive lung disorders, there are different types of disorders, right? And in a simple form, it is called as CBABE, right? So what is the meaning of CBABE? Here C stands for cystic fibrosis, a B is a bronchial ectasis, A is asthma, here B is chronic bronchitis and E is emphysema. It means there is a total of 5 disorders, and all those disorders are basically known as obstructive lung disorders, right? Out of all these 5 disorders, chronic bronchitis and emphysema are the part of chronic obstructive pulmonary disease. It means here we know the COPD is a common term that is used to explain about the obstructive lung disease. But COPD doesn't mean that all the different type of obstructive disorders are the part of COPD. Here, out of 5, only 2, that is chronic bronchitis and emphysema, they are composed, actually the COPD composed of these 2. So there are other 3 diseases or disorders which are also due to the obstructions in the air passage, which is also due to the limitations of airflow during exhalations. Now see, what is the physiological basis of all those diseases? I will not go into the details now. Still, I have to mention at least a few points to explain those obstructive and restrictive lung disorders. Here you can see COPD is a progressive and chronic lung disease that includes the chronic bronchitis and emphysema, and it is often caused by long-term exposures of different types of molecules like irritating particles or gases like cigarette smokes, air pollution and workplace fumes. So these are the causative agents that may lead to the developments of COPD, that may lead to the developments of chronic bronchitis and as well as the emphysema. So what is the features of asthma here? You can see it is characterized, it is a chronic condition actually, which is characterized by inflammations, right? So inflammations means if you see the air passage, the inner side of the lumens are composed of epithelial cell layers. And if there is an inflammation in the epithelial cell layer, it ultimately affects the normal passage of normal flow of air mainly during exhalations. So, and it is often triggered by various factors, and most important factors are different types of allergens and respiratory infections, and even in some cases like during exercise stage or in stress conditions there is a high chances of the development of this obstructive lung disease called asthma. And what is bronchiectasis? Bronchiectasis is conditions where the airways in the lungs becomes permanently dilated, right? And the dilatations again is mainly due to the inflammations in the air passage, or dilatations is mainly due to secretions of mucus secretions that ultimately build up a mucus clog across the air passage that affects the exhalations during expiratory process. Now see, from these figures you can see about the basic pathophysiological features of cystic fibrosis. Here you can see this is the normal conditions. Airways opens that allows the air flow through this passage, right? But when there is a physiological conditions developed, when there is a cystic fibrosis, it prevents the normal flow of air, right? You can see here there is a poor airflow due to the cystic fibrosis. And the most important causes of this cystic fibrosis is mucus clogging, mucus that clogs the normal air passage, right? Here there is a depositions of mucus across the borders of the lumen, right? Now lumen becomes very narrow. That is why there is an obstruction in both during the inhalation process as well as exhalation process. But most important thing is it mainly affects the exhalations ones. As we already know that the cystic fibrosis is not only developed due to the mucus depositions across the air passage, we also discussed about its genetic basis in previous one lectures. Now another important disease that is bronchiectasis. You can see here the normal air passage, right? There is no mucus secretions across the lumens or passage, but if you see this one, again there is a depositions of mucus, and this mucus depositions along with there is a scarring of lung tissue. Means in bronchiectasis you will find the lung fibrosis, scarring of the lung tissue. This lung fibrosis or scarring of the lung tissue actually reduces the total diameters of the passage that prevents the normal flow, mainly the exhalations. You also can see from here what are the other things that may occur during bronchiectasis is loss of cilia, that is ciliary damage, which is very essential for the inhalations as well as exhalations. But in bronchiectasis, you will find the damaged cilia, right? Not even ciliary damage occurs in bronchiectasis. There is a damage of luminal valve, right? Inner valve, that ultimately leads to decrease in the diameters of the airway, right? Now see, what is about the asthma? Again, It is a part of obstructive lung disease. So you can see here in the first diagrams, it is a normal airway that allows the sufficient amounts of air as well as that allows the exit of sufficient amount of air during exhalations. Once there is a asthma attacks, so what are the physiological changes that occurs into the air passage? You can see here mainly two things happens here. So what are these? There is air trappings into the lung alveoli. It means if there is a very less exhalation of air, so air starts accumulating into the lung alveoli inside the lung. So we know the lung alveoli has a maximum capacity, but due to the less exhalation, the air is going to trap inside the lung alveoli. In one time, there is a high chances of the rupture of lung alveoli because alveolar walls very delicate. So due to increased air pressures into the lung alveoli, there is a high chances of the ruptures of alveoli, right? So you can see here the asthma attacks, air trapped inside the lung alveoli. Along with there is a constrictions of the smooth muscles. You see in case of normal wall, these are the smooth muscles that is around the passage or airway, and here during asthma or asthma attack, you will find some changes into the smooth muscles characteristics. Here in normal conditions, it is in the relaxed state, but here in asthmatic conditions, it tightens the smooth muscles. Means there is a constriction of smooth muscles. Along with this, you can see the valve is inflamed and it becomes very thin. Means there is some physiological changes in the passage. The first is there is a changes in the characteristics of the smooth muscles. Along with there is a changes in the diameter of pulse, and it is mainly due to the secretions of mucus from secretory glands, as well as this is due to some inflammations across the epithelial layers of the lung air passage. So ultimately leads to the effects in the exhalation process. Now, what is the features of the chronic bronchitis? Again, you can see the chronic bronchitis, it is also due to the excess mucus secretions into the air passage. Along with, if you see the properties of the alveolar structures, and there is a changes in the shape as well as the size of the lung alveoli, and it is only due to some particle when the person is exposed to those particles for a longer period of time, they are having more chances of developments of this chronic bronchitis. What are those substances? Those substances are some irritated materials like small particles, right? Like one is the size, whose size is very tiny, called particulate matters. So if the person is exposed to particulate matters frequently, they are more prone to the developments of these particular conditions called chronic bronchitis. And if the person is exposed to these particulate matters or irritant materials, there is a high chances of the inflammations in the air passage that ultimately obstruct the air flow. Now, the last one is called emphysema, as I already mentioned. You can see the normal alveolar structures, normal structures of bronchiole. Now, along with this, you can compare the structures of alveoli in emphysema conditions. There is an increase in the pocket size of lung alveoli, and it is only due to the excess depositions of air into the alveoli, and it is mainly due to less exhalation of air during expirations. Now, along with this obstructive lung disease, we have already mentioned that there are some conditions that may occur in the lung, and that are related to the restrictive lung disease. So now we need to know what is the physiological basis of the restrictive lung disease, right? Here, in this case, the most important thing is the lung tissue itself becomes very stiff, right? Lung tissue becomes very stiff. Due to the stiffness of the lung tissue, it restricts the expansions of the lung. The most important point here in the restrictive disease, there is a less expansions of the lung. Means there is a changes in the size of the lung. There is a reduced lung in restrictive conditions. That is why I mentioned here. There is a restriction restricting the expansion of the lungs. And these restrictions ultimately leads to reduced lung volume and a decrease in the ability to inhale adequately. So it means in the restrictive lung disease, there is mainly two different conditions. There is a changes in the lung size, right? Means there is a reduction in the lung size, and it is only due to the reduced expansions capability. So if there is a reduced expansions capability, obviously there will be less volume of air in the lungs in the restrictive conditions. So these are some types of restrictive lung disease, right? Like interstitial lung disease, right? The pneumonia and pulmonary fibrosis. I will not go into the details of all those. Instead, I will try to explain about the different types of lung function tests that is useful to diagnose all those diseases. Now, before knowing about the different type of lung function tests, at least we should know what are the major or what are the most important differences between restrictive and obstructive lung diseases, right? The first one you can see, in case of obstructive lung disease, it is primarily characterized by airflow limitations during exhalations, whereas in restrictive lung disease, it is characterized by reduced lung volume and limited expansion during inhalations. You should remember in these 2 points are very important. In one case, there is a limitations during exhalations. In another case, mainly in the restrictive conditions, there is a reduced lung volume and limited expansion during inhalation. So what are the most important causes of both obstructive and restrictive lung disease? In case of obstructive lung disease, it is often associated with different factors that lead to airway inflammation as well as obstruction. Whereas in case of restrictive, there is a lung tissue damage and lung fibrosis called scarring, right? So these two are the most important features why you can differentiate the obstructive and restrictive lung disease. Now, as I mentioned, there are numbers of lung function tests that are very much useful to diagnose all those obstructive and restrictive lung diseases. So, what are those lung function tests? So, these are the different tests. So, what are these? The most important one, the spirometry, the lung volume testing. So, as I mentioned, there are a number of tests that are used for the diagnosis purpose, that are used for the diagnosis of both the obstructive and restrictive lung disease. So, these are spirometry, lung volume testings, gas diffusion test, then lung diffusion capacity test, and along with exercise test. So, here in the today's lectures, I will mainly focus on the most important one, that is about the spirometry, right? And I also, I will express in little ways about the other tests. So here, the most important one, the spirometry. So what is the features of the spirometry, right? The most important features is it measures how much air you can inhale and exhale, and how fast you can blow air out. So this is the most important thing. Means the spirometry test is useful to measure the amount of air during inhalations as well as the exhalations, and it also measures or estimates about the flow rate, right? How fast you can blow? Yes, out. Mainly the flow rate during the exhalation process. Other than this, you can see the lung volume testing. It calculates the total amount of air that lungs can hold. Gas diffusion test, it assesses how well oxygen moves from lungs into the bloodstream, right? All these things I have already discussed during theory lectures. Lung diffusion capacity test. So, what is the most important features of this test? This test determines how effectively oxygen and other gases transfers from lungs to the blood, and it is also useful in diagnosis the conditions like pulmonary fibrosis and emphysema. So, here as I mentioned, there are multiple numbers of tests. Before going into the details of the spirometric assessments, we must know about the basic concept of two things. One is the static lung volume and capacities and dynamic lung volume and capacities, right, in normal conditions. If you define the static lung volume and capacities and dynamic lung volume and capacities, there is a little difference. Here, difference is, in case of static lung volume and capacities, it doesn't depend on time. But here, the dynamic lung volume and capacities is time dependent. So, we have to explain both the static and dynamic lung volume and capacities in different way. So, here you can see this is the diagrammatic representations of static lung volume and capacities. This is very important for all of us. You must know what are the four important volumes, what are the four important capacities, and what is their value, because these values or this volume and capacities is the most important one to diagnose the lung function, right? That is why the static and dynamic lung volume and capacities is very important for us. So, what are the most important lung volumes? You can see from here the most important ones, these parts is called the tidal volume, right? Tidal volume. So, other than this tidal volume, just above the tidal volume you can see this is the inspiratory reserve volume, right? And just below the tidal volume you see this is the expiratory reserve volume, right? Along with this you can see this is the residual volume. So, there are mainly four different volumes. Now, what is the meaning of tidal volume and what is the amount of tidal volume for healthy persons? Obviously, the tidal volume actually defines about the normal inhalation and normal exhalation process. We have a specific amount of volume that can inhale and exhale during normal breathing process. So, what is the normal value of tidal volume? This is around 500 ml, right? This part is called the inhalation and the downward part is called exhalation. So, what is the total amount of tidal volume? It is around 500 ml. Now, comes to the next part, that is inspiratory reserve volume. What is the meaning of inspiratory reserve volume here? So, you can see from here, inspiratory reserve volume, it is the amount of air that we breathe in forcefully after normal inspirations. Means the persons inhale normally first. After that, during forceful exhalations, the persons exhales sufficient amount of air. So, here in case of inspiratory reserve volume, it is the amount of air that we breathe in forcefully after normal inspirations, right? Now, see this part is called forceful inhalations and after that there is an exhalation, right? This is called inspiratory reserve volume. So, what is the amount? That is around 3000 ml, right? Now comes to the next part, that is the expiratory reserve volume. So what is the meaning of expiratory reserve volume here? It is the amount of air that can be exhaled forcefully after normal tidal expirations. Means we have a capacity to exhale the excess amount of air after normal tidal expirations. But the amount that we can exhale after normal tidal expirations varies person to person. So, here you can see about the expiratory reserve volume. It is the amount of air that can be exhaled forcefully after normal tidal expirations. And what is the amounts? The amounts of expiratory reserve volume is around 1000 ml or a little more. And other than these expiratory reserve volumes, you can see about the residual volume. Residual volume is the volume of air that remains inside the lung alveoli even after completion of full breathing process, right? Now, what are the different type of capacities? The capacities are the vital capacities, then functional residual capacities, then inspiratory capacities, and along with the total lung capacities. These are four main capacities. So here you can see the vital capacities. It is the maximum amount of air that can be exhaled forcefully after maximum inspirations. Again, in healthy state, if you see the level of vital capacity for healthy person, you will find a particular levels, and even if you compare the vital capacity between two persons, you will find some differences. So what is the most important things here? I will explain how the vital capacity changes during the obstructive lung disease as well as the restrictive lung disease. So another important thing that is called inspiratory capacities. What is the thing? The thing is, it is the maximum amount of air inhaled after normal expirations. Means after completion of the normal expirations, the persons are able to inhale more amount of air, right? This is also varies in case of disease state, right? So what is the inspiratory capacity here? Actually, if you see the capacity, these are nothing. These are the sum total of at least two volumes. These are sum total of at least two volumes. In some cases, it may be more than two. Like in case of total lung capacity, it is the sum total of all the four different type of volumes. So what is the functional residual capacity? It is the amount of air that left in the lungs after normal expirations, right? And the total lung capacity, it is the maximum amount of air that lungs can hold. So here, as I mentioned, all these things are the part of the static lung volume and capacities, and when the time is involved, we will explain the things in a dynamic lung volume and capacities. And even what I want to mention is, though there is a certain levels for a particular volume and even for a particular capacities, this levels varies person to person. This level varies in diseased conditions in comparison to the normal conditions. Now what we have some tests to diagnose, to assess the lung functions of persons. The first important one, as I mentioned, is called the spirometry. The most reliable one is the spirometric assessment of the lung functions. So what is the features of the spirometric assessments of the lung functions? Right? These tests mainly assess the degree of airflow limitations during expirations. As I mentioned, during expirations, during obstructive lung disease, the most common problem is, or most pronounced problem is in the exhalation process. So here the spirometric test is used to assess about the limitations during expirations, right? See, this can be explained by a particular curve called F1 curve or FEV1 curve, that is force, expiratory, volume during the first second of force vital capacity, right? So these curves is very essential. So what is the most important features of these curves? See, in case of normal subject, are very important. I need your attention, please. Very important. This is called as FEV1 curve, forced expiratory volume during first second of force vital capacity. For normal subject, this can be plotted by using this particular type of curve. In x-axis, you can see it is the time, and y-axis it is volume, right? What is the overall vital capacity here for the healthy subject? It is around 5 liters, right? When a person breathes, I mean, if you see the force vital capacity of healthy subjects, the value is around 5 liters, right? So what is FEV1 curve means? It means at the first second of FVC, the persons can exhale a particular volume of air only. If you compare this volume of air with the person who is in obstructive conditions, you will find some differences, right? So here at the first seconds of FVC, the volume is around 4 liter, that is FEV1 value is 4 liter, but FVC value is around 5 liter, right? Now, to diagnose the subjects, we have to use the value of both the FEV1 and FVC, right? So here FVC is 5 liter and FEV1 is 4 liters, and the ratio is around 0.8 or 80%. So if the percentage or the ratio of FEV1 by FVC is 80% or more, then only we can say the person is in normal conditions, which is reflected here in this curve. In this particular case, the FEV1 by FVC ratio is 80%. It means the person's breathing capacity is normal. Persons do not have any type of obstructive conditions. But if you see this graph, it is the graph which is plotted from a particular subject who is suffering with the chronic obstructive pulmonary disease. Now, what is the difference here? See the FVC, the previous one, see the FVC, this is the FVC, right? And here, this is the FVC, it is around 3 liter or a little bit more from 3 liter, right? FVC value is little bit reduced. Along with this, if you see the FEV1, that is forced expiratory volumes during first second of exhalation, again there is a drastic reduction. It means subjects unable to exhale sufficient amount of air. So here the measurement was taken the very first second of exhalation, right? So here the FEV1 value is only 1.3, only 1.3. So if you see the ratio or FEV1 persons, see only 41%. The ratio of FEV1 by FVC is only 41%. As we know, for healthy subjects, the person should be the 80%, but here it is only a 40 or little bit more from 40%. It means subjects are suffering with some particular type of obstructive lung disease. Here it is about the asthmatic patients, it is about the COPD patients. So, due to the shortage of time, I like to conclude today's sessions here, and I will try to continue the same things in the practical class. Maybe we are going to start the new practicals about the spirometric assessments of the lung functions. So, I will try to explain the rest of the part in practical class. Either I will explain, else Shomer sir will explain the things in the practical class. Okay. Thank you.